70-year-old diabetic who is hypertensive investigated with angiogram. 2 days later, he developed dyspnea, mottled skin, and BP increased to 180/100, had eosinophilia. Basically, those who have atherosclerosis, they have a risk of having an atheroembolism, where the embolus can go to the kidney, renal artery. So, this is a typical scenario. Sometimes whenever you do an intervention, then you will be dislodging and predisposing to the development of a atheroembolism. So, in such case, if you happen to do kidney biopsy, you will discover the microvessel occlusion with the cleft in the vessel is what need to be remembered. That's right. Chandu and Madhuri say, we are clearing the exam because of the coaching. Oh, we are coaching because you are clearing the exams. So let me tell you the other way, the secret. I was quite happy today till morning 7 o'clock. Me and Srinivas in Vizag, one of our students, we were all awake to give an authentic answer and trying to find agar kuch mistake milega, to kime, so that it will salvage. So definitely, doctor, it gives us an additional energy, and please do come for the next Saturday, Sunday onwards. We will have serious continuation of the classes. Every day, daily classes will start from Monday, that is on 16th onwards, with a subject test and discussion also. So we have Dr. Periyaswamy Selvaraj will be coming down on Saturday to review orthopedics for all of you. Yeah. Now, doctor, this is a classical example. Cleft bolte ne doctor, cleft in the due to the microembolus is being found. Actually, this question is a straight picked up from a journal, one case study in a journal. Okay, so don't worry if you didn't do right. Pompholy, classically tapioca like vesicles on the palms are a true statement. They are pruritic and also painful. So these are the typical tapioca like lesions, doctor. On the palms and on the sides of the fingers they will be found, and it is an eczema which affects the hands and also the feet, is what you need to basically remember. Potent topical steroids are the ones you need to basically remember. Sagar gives a very good reply that because TB was there, I only did not even check the X-ray and answered TB effusion. I am telling on a lighter vein, doctor, don't do that next time, and if you go wrong, I will not be responsible. But general rule to wo hai. General rule to wo hai. On a Valentine Day, if you say I love you, you should get acceptance. That is the general rule. But agar thappad mil gaya to, that can be exceptional, right? So that's good. Now, rotator cuff tendinitis. For a simple medical student to know that there is a break in acromion, there is a spur in acromion, wo to Vedantic level of orthopedics. Steroid injections are very much indicated. That's the point. What you can see is an acromial break is what you are basically finding it over here is what need to be remembered. Then we give subacromial steroid and local anesthetic in order to treat. Pure guesswork. Preparation करने से मिलने वाला क्वेश्चन नहीं है. Oh, this is the annoying question in the image based questions. पूरा image based questions are benign. ये तो annoying question. Bar chart क्या होता? Which is for qualitative, which is quantitative, which is for categorical, which is for discrete. So all these things you must know the funda. So fundamentally, doctor, this is called histogram. On a histogram, you can draw a frequency polygon, and histogram is basically for continuous variable, which is quantitative. Then this is a bar diagram. The other one which is being shown is a bar diagram. So bar diagram is fundamentally for what, doctor? It is for categories which are qualitative. You will be using the bar diagram. Examiner want it. Ottawa's ankle rules, nobody knows. History में पहली बार creative question. आजकल के कंज्यूमर कोर्ट में किसी को भी आप एक्सरे करे तो भी जज साहब एंग्री हो जाएगा. जिसको रियल रिक्वायरमेंट है उसको एक्सरे नहीं कराए तो भी यू विल बी बुक्ड अंडर मेडिकल नेग्लिजेंस. सो यू मस्ट बी रेडी टू डू व्हेन टू व्हाट. सो Ottawa said, in a case of any ankle injury, though the radiology lab owner is your brother-in-law and your wife is general medicine and she has sent you the case and you are orthopedic Dr. Goodilingam, you have to be careful before being a Jambalingam to get an X-ray done. In which situation you want to do? If there is any pain, if there is any tenderness along the distal 6 centimeter of the posterior edge of the tibia, then only. So whatever rules are when to do the X-ray in case of a leg injury. IgG immunofluorescence deposits are there. वहां तक स्टोरी अच्छा है. मगर वो DLE और SLE DLE अरे why is this question should come? This year I had to get seat anyway. You may be thinking in exam hall. But the idea is uninvolved skin and also involved skin involvement होता है SLE में. Same dermoepidermal junction deposition, if it is occurring only in the involved skin, then that becomes discoid lupus. ये सूक्ष्म के अंदर का मोक्ष है. सो इसको मालूम होना बोले तो आप तो डिप्लोमा इन पैथोलॉजी और समथिंग यू मस्ट हैव बीन. MBBS लेवल का क्वेश्चन नहीं है वो. देन टू सप्रेस ओव्यूलेशन, and relieve the pain, what are all the things that you use in case of endometriosis? Any condition may, you will have first line drugs, second line drugs, last resort to drugs is ultimately orphan drugs. Different levels होता है. So, you will give a dipomedroxyprogesterone, neferilin, all these are in the first level. If there is no response coming at all, then aromatase inhibitor like anastrozole is given. It is not recommended for routine use. That's what examiner want. ये प्रिपेयर होने वाले आंसर करने का क्वेश्चन नहीं है. गेस प्योर गेस. इसलिए 60%, टॉपर आल्सो 60% तक गेस मार सकते. उसे ज्यादा गेस मार करेक्टली मार रहे बोले तो ही इज रिलेटेड टू समवन एट सम लेवल इन कैबिनेट. सो बी श्योर. This is actually a guess because it is not within that 130 high yield topic list. But it is a very old question. Hermansky Pudlak is fundamentally what? Hypopigmentation and albinic appearance. So that is the reason oculocutaneous albinism is a component of Hermansky Pudlak. It is not hyperpigmentation. Whereas Busalpan, Edison, Nelson is सब में knuckles के ऊपर classical locations for the hyperpigmentation is what need to be basically remembered. 40-year-old with menorrhagia since 1 year and ultrasound is showing a single intramural fibroid is there, then what are the treatment options because she does not want to undergo the hysterectomy. So basically, simple thing to remember is menorrhagia treatment के लिए आप hormonal IUCD, not a non-hormonal IUCD you will use. That non-hormonal only must be attracting you because menorrhagia, dysfunctional uterine bleeding is a very high yielding topic. अगर आप वहां नहीं पढ़े तो IUCDs का non-contraceptive uses of the intrauterine contraceptive devices बोल के एक discussion Dr. Shilpa has done on the same floor in our weekend classes. So you should correctly answer, but no problem if you didn't answer. Because this comes under the 53 guess wala questions जो miss कर सकते. So this is an example of that Mirena being placed whenever a intramural myoma is causing the bleeding is what need to be remembered. Oh, this is the MCS urology wala question है. प्रोस्टेटेक्टमी में दो तरीके की प्रोस्टेटेक्टमी होते हैं, एक होता है पेरिनियल प्रोस्टेटेक्टमी, ओरिजिनली रैडिकल पेरिनियल प्रोस्टेटेक्टमी 1905 100 साल के पहले यंग ने इंट्रोड्यूस किया। मगर हम 21st सेंचुरी में क्या कर रहे हैं, किसी आदमी को 55 इयर्स, एनी मेल हु क्रॉस्ड 55 इयर्स, we are getting his serum cholesterol, creatinine, thyroid, everything is normal, means we are little disappointed, no? We will also get the PSA done. Very early we are diagnosing nowadays what? Prostate cancer. When we are diagnosing very early, there is no need of doing a radical lymphadenectomy. Doing a radical lymphadenectomy is the part of what procedure, doctor? Retrograde prostatectomy है ना, RRP. RRP में you will be doing what? Retropubic prostatectomy में you will be doing pelvic lymphadenectomy also. But early diagnosis कर रहे हैं ना, इसलिए RRP is not really required. You can still do radical perineal prostatectomy. Because nowadays prostate cancer cases found are found in a very early stage. So इसलिए इसका history क्या हो गया? The radical perineal prostatectomy was original prostatectomy discovered by Young 1905 में. 1947 में the radical retropubic prostatectomy was introduced and they said we will also do the pelvic lymphadenectomy. But once more we came to the modern era where early diagnosis of prostatic cancer is telling us there is no need of doing such a radical procedure, the original perineal prostatectomy is good enough. So इसलिए perineal prostatectomy Young originally was a very commonly done procedure. Still majority of cases we do retropubic, but the modern school of thought is there is no wrong in once more accepting to do radical perineal prostatectomy of the young, and still it is not a commonly done procedure. If you find lucky enough to find an early stage, because of better screening procedures, you can still do perineal prostatectomy of the young. इतना है इसका स्टोरी. So इतना स्टोरी MBBS लेवल में ही आपको मालूम है बोले तो कुछ something fishy, you know examiner is going to give this. Lot of people don't answer this question. If you did this wrong, don't worry. If you did this right, it will compensate that mistakes you did in that 130. 130 not supposed to do mistakes questions है ना, वहां जो एक गलती है यहां subtract हो जाएगा. Oh doctor, what is Pomeroy, what is Uchida? If you don't know anything, if you still answer Pomeroy, that will be the correct answer. Because Pomeroy is what examiner want to ask. Question bank में अगर एक topic है तो Pomeroy का होता, Uchida को rarely होता है. So that's the point. So what is Pomeroy? Loop of proximal portion of the ampulla is elevated to reveal the vascular supply of the. Why is this elevated? To know the vascular supply of the underlying mesentery. And then you are making a loop, you are clipping it, you are sealing it. So this is the Pomeroy. Now doctor, Gynifix, so a special type of a intrauterine contraceptive device. इसका speciality क्या होता है? You can fix it into the underlying myometrium. What is the biggest problem? Two biggest problems with the intrauterine contraceptive device. One is expulsion, other is bleeding. वो expulsion का risk को कम करने के लिए a special type of device called Gynifix is used. Is it T-shaped? No. So regular copper devices कैसा होता? T-shaped होता. So it is not T-shaped, and it contains copper, not levonorgestrel, and risk of expulsion is lesser, and the leftover thing is there. But still, Yassur device is there? No. That we are all prepared. Gyniflix के लिए उतना preparation नहीं हुआ. तो इसलिए I kept this in that 53 pardonable situations. अरे एनाटॉमी में वो होता ना, क्या होता? वन इलस्ट्रेशन बुक होता ना डॉक्टर, हम एग्जामिनेशन में सबमिट करना पड़ता ना. Then we will pay to our other classmates who don't have money for eating breakfast, and they will draw all the illustrations and do record work. Sorry, a record work question, doctor. Coloring book. So what is this triangle? Fundamentally it is carotid triangle between posterior belly and omohyoid. One more coloring book in physiology records. Different stages. So examiner's question is about that picture, na? So you must know what is isovolumic relaxation, what is rapid filling, diastasis, atrial systole, same ditto same picture, which you need to be very sure on the contraction. Then antipsychotic agents. Already we don't know whether a drug is antipsychotic or antidepressant. That's the biggest confusion in psychiatry. Uske upar se olanzapine, clozapine, quintiapine, luceridone, too many pins are there. So doctor, quetiapine cataract is sort of expected fact for a lot of people. But if you don't know all the remaining three also, the fourth one you can know easily. You are more worried about haloperidol and neuroleptic malignant syndrome, and clozapine has an advantage that it does not cause. So that's the reason it can very much be given in the history of neuroleptic malignant syndrome, which is more with typical antipsychotics. Even if you don't know the remaining three facts also, fourth by elimination you can answer. Right? Oh doctor, needles, sutures. Without that there will, एक suture already आ गया ना? Acrylic, और एक suture भी है. चलो, what is this? What is that? कभी OT को गए तो हम lot of time our time is gone in watching our classmates. Oh, nice dress, and that is the only occasion where we can be little closer to our classmates. We can closely watch them, whether we can propose or not. So third year, fourth year में OT में where we will get focusing on the blood field. There is a lot of bloodless field available. So doctor, it is artery forceps and needle holder. But future entrance में APPG में आएगा. इसको बोलते हैं thumb forceps. It is called sponge holder. Sister Mary will be knowing you and teaching you. This is called ovum forceps, not for. Is it holding for ovum? No. Shape के वजह से. This is called Alice tissue forceps. This everybody will be knowing, right? Then this is mosquito artery forceps, which is called carud one, and this is the needle holder. You must be quite sure. Then abraded collar. हाँ, बहुत लोग इसको controversial question list में भिजाओ क्योंकि distance of firing also is related बोल के they were requesting. It is direction of firing, that is the fair deal. Examiner actually is right. If it is straight like this, if it is like this, there is a difference in the appearance of the abrasion collar. But what is an important thing about abrasion collar? Irrespective of the firing distance, the abraded and depth collar is usually present. That's the reason it won't give any clue about the distance. Clear cut statement in forensic textbook. So only direction, no distance. Still you want to believe it is distance and examiner will change it. No doctor. Examiner did all care to see that we will not claim too many things. Prophylactic antibiotics. People are angry about this question also. Last time our unit 2 PG ने 4 दिन के बाद दिया है सर्जरी के बाद, इसलिए मैंने सोचा कि 1 आवर के पहले देना है बोल के मुझे मालूम नहीं। अरे आपका पीजी वैसा किया, टेक्स्ट बुक में वैसा करो बोल के कहीं भी नहीं लिखा, तो दैट इज रीजन। He was given as at the induction of anesthesia. This is that may become little controversial, doctor. That parenteral antibiotic 30 to 60 minutes before the surgical incision means incision के पहले induction होता ना anesthesia का. So that way it may be right. But 30 to 60 minutes के बाद incision नहीं देते ना. Will the 1 mark will be added or not? It depends on whether we are at 99. I'll recheck this because that went slipped out of my mind about the recommendations. I mean, yeah, but there are clear-cut guidelines which have been defined in relation to the surgical incision. That is with the induction of anesthesia, na? So at the induction of anesthesia was given. I think C should be the correct answer of the examiner. Prior to what? Which is the time of induction of anesthesia? That is with the induction of anesthesia बोल के लिखा ना? Administering the parenteral antibiotic 30 to 60 minutes before the surgical incision. That is with the induction of anesthesia. खत्म, खेल खत्म, दुकान बंद. So yeah, examiner is correct. Examiner this time is 100% sure, unless some typist while typing went for emergency coitus and missed here and there. Mistake होना chance ही नहीं है. It is thoroughly evaluated paper. What is correct about kidney development? What is except? Basically, mesonephric duct is Wolffian duct. Wolffian duct ka lot of derivatives are there of the Wolffian duct. Then, which lower fungi has nonseptate hyphae with sporangio? I still remember this one of our mock tests. We had a botany question. Fungi, they were into aseptate and septate. Is in that we have endogenous ascospore, etc., etc. Accordingly, Ascomycetes, Basidiomycetes, Deuteromycetes. All India PMT questions, 5-6 questions are there, MCET questions. Then, about the human hair. अगर एक bulb है तो भी you can make out the ABO blood group and decide whether the dead person is the president or not. Because his blood group was B and the hair on the dead body is A, he can't be the president who died in air crash. So ABO can be determined from single hair bulb. From any part of the body is what need to be remembered. This is another difficult question too. Difficult means a typical question. These are all big long facts. Headache will be there even without acute exacerbation also in case of the chronic maxillary sinusitis. That's the point you need to basically remember. Okay, so headache will be there without exacerbation also. Ringer's is also called inverted papilloma. Inverted papilloma is typically considered to be a benign warty neoplasm, not malignant in nature, is what need to be remembered. That bloody thunderstorm like appearance on the fundus, CR vivo. So you must know cartwheel appearance kahan hota, thunderstorm bloody appearance kahan hota. And अगर आपको मालूम नहीं है तो कम से कम estrogen containing pills means venous embolism and venous thrombosis. So it can be arterial because of the estrogen. Okay? Central retinal vein occlusion showing tortuosity and intraretinal hemorrhages. It looks like a bloody thunder. Then radiotherapy for cancer, doctor. Recently also we had an MCQ. Limited small cell lung carcinoma, what is the management? Limited versus diffuse. Limited, generally small cell lung carcinoma, there is no role for radiotherapy. अगर limited है वो, then the thoracic radiation along with the chemotherapy can have a role if it is a limited small cell lung cancer. Radiation?
Breast conservative surgery is done for early invasive cancer. Lumpectomy, sampling and radiotherapy.
Yeah, 70% of women with early stage breast cancer whose tumor is between 1 and 2 centimeters, so tumor size less than 2 centimeters, and lymph node negative are cured by standard surgical techniques. Right, breast conservative surgery. I think option 4 also. This is one more contestable question. This went out of my thought process. This also contestable. Option D is contestable. So, then the first one is definitely wrong option. A rise in PSA brachytherapy में इसको PSA bounce बोलते हैं. Brachytherapy अगर आप दे दिए तो PSA suddenly elevates. इसका मतलब recurrence हुआ बोल के नहीं. That's what you need to basically understand. Fifth vital sign. First of all, what are the first 4 vital signs, doctor? Temperature, pulse, BP, respiratory rate. Fifth is called pain in the assessment. Now, doctor, we all know. I think this is an easy question. Actually, 130 list में ये जाने वाला question है. But guess वाला question. Diazepam is benzodiazepine. Barbiturates are phenobarbital, etc. Barbiturates are more CNS depressant in nature than the benzodiazepines. इसलिए alprazolam देते. Alprazolam सोने के लिए नहीं देते. अगर सोने के लिए दिए तो इसको बोलते हैं hypnotic. Anxiolysis को लिए दिए तो इसको बोलते हैं sedative. Benzodiazepines होता है sedative, barbiturates होता है hypnotic, and barbiturates in higher doses lead to development of respiratory depression. एक साइंटिस्ट का नाम के बिना एग्जामिनर हैप्पी नहीं होगा. सो ही इज द ग्रेट रुडोल्फ विर्चो, रशियन. सो ही पब्लिश्ड द बुक कॉल्ड सेल्युलर पैथोलॉजी इन 1858. राइट. सो ये प्रिपेयर होके एग्जाम में आंसर करने वाला क्वेश्चन नहीं है. ओह, दिस इज अ ब्यूटीफुल क्वेश्चन, डॉक्टर. On a simple fact that Kieselbach venous plexus is not venous but an arterial plexus. Kieselbach plexus is an arterial plexus which is responsible for the epistaxis. Otherwise, temptation is to answer option 3. Huh? Patient is kept in sitting in slight leaning forward position. Epistaxis में, हाँ. B, I am sure. Slight leaning forward position while compressing, so he will die with asphyxia, you mean? Huh? We will find from our ENT surgeon about option A. Option A I didn't prepare, I was not there. Because I am already convinced about Kieselbach arterial or venous, maximum confusion वही होगा. huh? एक्यूट सीवियर आस्थमा के ग्रेडिंग कैसे होता है? क्लासिकल क्वेश्चन डॉक्टर, नेक्स्ट एंट्रेंस एम्स में आएगा ये क्वेश्चन. सीवियर परसिस्टेंट बोले तो पीएफ इज लेस देन 60, मॉडरेट परसिस्टेंट इज 60 to 70. इसलिए 60 to 70 इज नॉट एक्यूट सीवियर, इट इज कॉल्ड मॉडरेट परसिस्टेंट. If it is less than 60, it is called severe persistent, is what you need to remember. हाँ, अभी आ गया Murali Bharajwaj tailoring classes. So you must be sure on सालों सालों प्रिपेयर हुए, कुछ भी आमदनी नहीं है. Ultimately, your dress also will be torn. So you must know how to stitch it. So what type of suture? Persisting suture. What is this suture called as? Among the options given, this is called Paris suture, where the approximation of the edges of the wound by pasting the strips of cloth to the surface and stitching them instead of skin. Very old technique. Paris. Then Halsted is the interrupted quilt suture. Then you have simple interrupted, simple continuous, continuous lock. So that 2 months of surgery posting. Sutures, transfusion basics, and needles and surgical instruments. You have to review because nowadays it is the high yield area for the examiner. Occipital hemianopia. I told you, no, doctor, one question on the visual pathway defects definitely will be asked. Always, what is the rule? The more peripheral is a lesion, it will be incongruous. The more it is towards the visual cortex, it becomes a congruous hemianopia. इसलिए homonymous hemianopia is typically incongruous whenever the lesion is there in the optic tract is what you have to basically remember. Then what is meant by redox phenomena, doctor? Basically, whenever occipital lobe lesion is there, the individual loses his ability to distinguish between the objects. What he will see is only a moving object, but he doesn't know whether what is moving before him. That is called redox phenomena whenever the occipital lobe is involved. Then this is also guesswork answer. MBBS level ka question nahi hai. Fetal abdominal circumference, how will you measure, doctor? The point of confluence of umbilical vein, portal sinus, fetal stomach, whenever you visible, that is the point at which you have to calculate the abdominal circumference is what you have to basically remember. Ross procedure kya hota hai? Suppose somebody is having a pathological aortic valve. पैथोलॉजिकल आयोर्टिक वाल्व, अगर उस आयोर्टिक वाल्व को निकाल के आप प्रोस्थेटिक आयोर्टिक वाल्व लगाए, लेफ्ट साइड इज व्हाट हाई प्रेशर जोन. So that is the reason what will happen, that graft which you have placed quickly damage हो जाएगा. अगर उन्हीं के नॉर्मल वाल्व जो पल्मोनरी वाल्व है उसको लाके आयोटिक वाल्व, दोनों सेमिलुनर वाल्व्स है, वहां लगा के वो पल्मोनरी वाल्व एरिया में अगर आप प्रोस्थेटिक लगाए तो थोड़ा ज्यादा दिन पंक्चर्ड पया स्टेपनी लगाए तो काम करेगा. सो दैट इज नॉट सर्जरी मीन्स व्हाट डॉक्टर, अल्टीमेटली कार्पेंट्री एंड टायर रिपेयर शॉप. Only thing is you will be doing in an air conditioned theater with some nurses helping you. There chotu rehta hai, so he will bring everything and give you and then you will repair. But otherwise you have to put in water, see for the bubbles. All those things are the routine thing. So Ross procedure. इसलिए मैंने 52 में लगाया इसको. तो ये टू मच कार्डियोलॉजी पढ़े तो आंसर कर सकते. हाँ डॉक्टर, यहां आपको एक कॉफिन के लिड दिखाई दे रहे क्या? कॉफिन, कॉफिन. एग्जामिनर ऑल्सो सी हाउ अफेक्शनेट अबाउट यू. ही शोस एन एरो एंड शोस यू टुवर्ड्स दैट कॉफिन लिड. फिर भी आप, इफ यू डोंट रिकॉग्नाइज दैट इट इज अ कॉफिन लिड, कॉफिन लिड होता है स्ट्रूवाइट क्रिस्टल्स. कॉफिन बोले तो डेड बॉडी को लेते हैं ना डॉक्टर, उसको, उसका कॉफिन के लिड के जैसे दिखता है स्टोन, इसको स्ट्रूवाइट क्रिस्टल का नेचर होता है. कलरलेस 3 डायमेंशनल प्रिज्म लाइक कॉफिन लिड अपीयरेंस इज व्हाट नीड टू बी रिमेंबर्ड. मैग्नीशियम अमोनियम फॉस्फेट स्ट्रूवाइट क्रिस्टल्स. Fast technique. Lot of students say, no, this also should be given exception because it is fast abdominal sonography, not sonar. Arre doctor, examiner सोनोग्राफी को सोनू बोल सकते, सोनार बोल सकते, सो कहा है बोल सकते. उनके हाथ में है आपका पीजी सीट. आप ऐसे चीजों के ऊपर ज्यादा होश नहीं मचाना. तो इट इज एक्यूरेट इन डिटेक्टिंग इफ द ब्लड इज मिनिमम मोर देन 100 ml. दैट इज द फैक्ट एग्जामिनर वांटेड टू checkmate with you. फिर भी ये तो गौतम बुद्ध आंसर करने वाला आंसर है, लेसर मोर्टल्स के लिए नहीं है ये 52. Neoplastic epithelial cells in a lymphoid tissue, classical of Warthin's tumor. ये lymphoid stroma होता है, oncocytic epithelium होता है. This is the typical appearance of Warthin's. If you go through the surgery high yield topic list, doctor, 6th or 7th will be salivary tumors. Most ignored topic but most asked topic. HIV drugs. Without that, how can a question paper will be? Typically, efavirenz is contraindicated in the first trimester of the pregnancy because of its teratogenic effects. It's a clearly scheduled drug. All the remaining are true. Integrase, raltegravir, stavudine is lipodystrophy, and diadenosine is peripheral neuropathy, etc., etc. Then hormone replacement therapy के बारे में basically tibolone. Tibolone क्या होता है डॉक्टर? These are the tibolone tablets. कितना है यहाँ लिखे हुए? 2.5 mg और यहाँ कितना दिया? 25 mg. Too much ना? 10 tablets कोई भी नहीं लेते. Hormone replacement बोल के. It is not emergency contraception. So steroid hormone basically it is synthetic steroid hormone. And it is used for hormone replacement and also for postmenopausal women, etc., etc. They are all true statements. So that is the reason. What is the answer, doctor? It is used. It typically causes endometrial atrophy and hence use it for excessive bleeding to stop the postmenopausal women may. Then keratoconjunctivitis sicca. ड्राई आइस, कुछ लोगों को हेरिडिटरी होता है, विटामिन ए डेफिशिएंसी की वजह से होता है, और एनी लिम्फोसाइटिक डिस्ट्रक्शन ऑफ द लैक्रिमल ग्लैंड्स हो गया जॉग्रन में, देन ऑल्सो यू विल गेट ए ड्राई माउथ बिकॉज ऑफ द सबलिंगुअल ग्लैंड, सैलिवरी ग्लैंड डिस्ट्रक्शन, यू गेट ड्राई आइस बिकॉज ऑफ लैक्रिमल इन्वॉल्वमेंट. आंखें ड्राई है बोल के आप साल्ट वाटर नहीं डालते ना. कॉमन सेंस क्वेश्चन, गेस करना पड़ता. 3% सोडियम क्लोराइड, नॉर्मल सलाइन मीन्स 0.9%. नो डॉक्टर, एबनॉर्मल सलाइन, टर्मरिक वाटर, ये सब लगाते क्या आंखों में? Examiner want to be careful before giving you MS ophthalmology seat. Then what is polyterization? Polyterization, inflation of the nostril with an olivary nozzle when the patient sips the water. But no more we do this barbaric procedure that frequently. Inflating, typically it is to reopen the eustachian tube and equalize the pressure. Okay. Next time when you keep complaining too much about ear pain in the aeroplane, air hostess will start polyterizing you. So be very sure. Carcinoma rectum. What did I tell you? Any APPG, one colorectal cancer ke bina, there will be no APPG. So doctor, Hartmann is for old debilitated people where you can't do definitive anastomosis, which is much more extensive. Spurious diarrhea and tenesmus will be found. Stage A means it is only confined to rectum. They are all true. I don't know. I didn't check the option B. Digital rectal examination ka sensitivity kitna hai, I too did not check. But maybe it is true. Stridor. Not in atrophic laryngitis. Laryngomalacia, multiple papillomas, any obstruction in the trachea can cause. Then doctor. This is a beautiful question. Once more, guesswork. Not a routine question. इसमें दो चीजें हैं, एक मेडुलरी स्पॉन्ज डिजीज है और दूसरा पॉलीसिस्टिक किडनी डिजीज है. इफ एट ऑल एनी स्टूडेंट डिड रॉन्ग, द रॉन्ग शुड हैपन बिटवीन द टू. इफ यू आंसर हाइड्रेटेड सिस्ट रीनल सेल कार्सिनोमा, बी हैप्पी, डोंट वरी, बिकॉज एम्स है, पीजी है, डीएनबी है, हम भी है. तो देन हाउ डू यू डिफरेंशिएट? सिंपल रूल. Whenever it is AD PKD, kidneys will be large in size and cysts are throughout. Whenever medullary cystic kidney disease hai, kidneys will be normal in size and they are only located in the medullary area. मगर इसको देख के ये नॉर्मल किडनी है या लार्ज किडनी है, सिस आर थ्रूआउट, वो तो दिखाई दे रहे, तो इसलिए आंसर होगा पॉलीसिस्टिक किडनी. एंड ADPKD is a high yielding topic. So examiner may be thinking about that only while framing, not medullary nephronophthisis, which is autosomal recessive variant. उतना अंदर नहीं सोच सकते एग्जामिनर. देन डॉक्टर, आइलेट सेल ट्रांसप्लांटेशन में आइलेट सेल को कहां डालते? एशेस को गंगा में डालते, वाराणसी में डालते, गया में डालते. तो यू मस्ट बी श्योर पोर्टल वीनस सिस्टम इज द साइट ऑफ प्लेसिंग द आइलेट्स. व्हाट इज द अर्ली साइन ऑफ कंपार्टमेंट सिंड्रोम? इट्स कॉल्ड स्ट्रेच टेस्ट. The pain which comes by stretching is one of the very early feature of compartment syndrome. सबको मालूम है ये मॉन्टेजिया बोल के. अगर आप गलियाजी सोचे तो डोंट वरी, यू डिड नॉट लूज एनीथिंग. गलियाजी होता है नीचे, गलीज नीचे होता है या ऊपर होता है? नीचे होता, तो इसलिए गलियाजी नीचे होता है. तो मॉन्टेजिया, मॉन्टेजिया में टाइप 1 टाइप 2 ये दिक्कत है. Type 1 होता है whenever it is an extension type where ulnar shaft angulates anteriorly and the radial dislocation also occurs anteriorly. Then you call Monteggia type 1. अगर reverse हो गया तो flexion type. Then इसलिए I did not keep, it's a very cruel question. Monteggia type 1 and type 2 to differentiate is MBBS level में too much है. स्केटोलॉजिया क्या होता है? बेसिकली टॉकिंग ऑन सेक्सुअल प्रोवोकेटिव डिस्कशन ब्रिंग्स द इरोटिक elevation for the guy, which is called as one of the type of paraphilia called scatologia, is what need to be remembered. One sexual perversion definitely examiner has to ask, no, unless he is straight. So that's the reason you must be quite sure on that. But all perversions are already over in all previous exams. So naya perversion, Googleophilia, then Facebookomania. So naya चीजें आ रहे रोज तो जल्दी सीट मारो. Then what is ED50 LD50 therapeutic index? ED50 होता है where it is effective in 50% of the people. Totally 20 है ना. So number of people, 50% is 10 people, controlled at 2 mg. Then 50% died become toxic 50, and 10 out of 20 died at 6 mg. So 2 mg, 6 mg. So sorry, first one कहाँ हुआ? 2 mg, second is 6 mg. So 2 by 6 become, 6 by 2 become 3 is the answer. Then doctor, नाइलॉन सुचर में रॉ मटेरियल कहां से आता? मदुरई मीनाक्षी सिल्क से आता या कहां से आएगा? तो दैट इज पॉलीएमाइड पॉलीमर. वन क्वेश्चन ऑन सुचर्स, absorbable, non-absorbable, all those funda you must be sure na. Then bacterial corneal ulcer में we don't use steroids. In all the remaining things we use cycloplegics etc etc. ये भी थोड़ा ophthalmology distinction level का क्वेश्चन है. Then rapid sequence induction of anesthesia में what drugs are basically used? The main advantage is it can be used even in the full stomach. And what will you do in this, doctor? You will apply a cricoid pressure, right, to prevent the aspiration. Selix maneuver बोलते ना, because patient has got full abdominal content, you are inducing anesthesia, so you have to prevent aspiration. So cricoid pressure लगा के, what drugs will you use? There are 7 P's for rapid induction anesthesia. P for preparation, pre-oxygenation, pre-treatment, paralysis, positioning, placement, post-intubation management. तो sedation के लिए we use midazolam and propofol and etc etc. I leave the literature. So this is the 52 guessable, unguessable questions. इसमें कितने write किया doesn't matter, because you did very good guessing here, but conventional 130 जो मिल सकता है भगवान के वर जो मिल सकता है वहां उसको विनाश किया, सेल्फ डिस्ट्रक्शन।